Hello, dear friends. Today we have Dr. Qasim. Dr. Qasim is an anesthetist here at Care Hospitals, Nampally, and he is of great help to us whenever we are doing surgeries. So, we are going to talk to Dr. Qasim about anesthesia. So, how they do their job, what kind of anesthesia, how many types, and all. Sir, welcome to our theatre. It's actually your theatre. Dr. Qasim, sir, if you don't mind, you can remove the mask.
Yes.
And we'll put on the mask later on.
Yeah.
Dr. Qasim.
Yeah.
Sir, so
Thank you.
Sir, there are cases we have done together. So
Yes,
many
yes.
cases. So
Perfect.
can you just tell our viewers about anesthesia? What is anesthesia, and what is your job, and how many types of anesthetic things you use?
Our job is to make the patient pain free, and patient should not have any memory or should not recall surgery or anesthesia. Whenever patient comes to OT, he should not remember the memory of OT, what is going on. So as soon as the patient comes, we sedate him first, and then we give anesthetic agents and make him sleep and pain-free procedures
So to cut it in short, your job is to make people put them to sleep.
and pain-free and should not remember.
Exactly. As we all know that anesthesia is something which helps a surgeon, any surgeon.
Right.
Surgery is something which you cut open the tissue. Sometimes you have to cut open the bones,
Right.
the chest, the entire chest. For CT surgeons, when they are doing bypass surgery
Open
and all,
chest,
they have
yes,
to open
yes.
chest. It's a very painful thing.
Right,
As you
right.
all know, giving a small injection is a painful.
True.
And there are so many procedures like orthopedic, ENT, head and neck surgeries, general surgeries, and neurosurgeries and all.
Yes.
Without anesthetist's help, we cannot do our job. So it is the anesthetist who help us doing the job. We do our job peacefully and perfectly because anesthetist is able to put that patient to sleep,
Right.
which doesn't give him sleep, doesn't give him any pain,
Exactly.
and he doesn't remember whatever
Anything
is
what is
happened
happened.
there.
That is
And
most important.
post-operatively, the recovery is also good.
Yeah.
Right? Sir,
Patient
could you
should-
just tell our people how many types of anesthesia are there?
Yeah. Broadly, there are two types. One is spinal anesthesia, when there is any surgery of lower limbs and below this thing.
So that is when the patient is conscious.
Yes, patient is conscious.
So there are two types of anesthesia.
Right.
One is when the patient is conscious, he knows what's happening. Another is
General anesthesia.
General anesthesia
When
when
he
he
is
is
patient-
unconscious.
unconscious.
Can you just tell us about types of anesthesia where patient is conscious?
One is spinal anesthesia, as I told you. We give some drugs in the spinal cord, in the spinal canal between the vertebra, so that any surgery of lower limb, or you can say below umbilicus, mostly gynecological surgeries. So there, patient doesn't realize any pain,
He doesn't
but
feel any
he is
pain.
conscious.
He is
yeah.
conscious.
Yeah.
And you give some blocks like
Blocks
some
also. There are so
when
many
you're doing
blocks
some
for upper limb.
ortho surgeries and all, right? Upper
Yes.
limbs, lower limbs and all.
And nowadays, so many blocks we are using, especially with the help of ultrasound, we can exactly give
Find the
drugs,
nerve,
find the
nerve
nerve and
that-
give at that particular area. We can small area we can select and give
Sir,
block that.
in general anesthesia, like would you be using a ventilator?
Yes.
Put the patient to sleep?
Yes. When we are using muscle relaxant, that time we use ventilator because when we are paralyzing patient, then at that time we need a support, ventilatory support.
Okay. Sir, I see that there is a case going on
Yes.
and you have just ventilated a patient. Can you just walk us into the theater
Sure,
while we put on this mask?
Sure,
and
sure.
Can you just introduce our people to your theater? And,
Right.
So, dear viewers, this is a theater, and you can just see the staff here. Is sister in charge, Sister Sunita. This is Sister Mini. She's our operating nurse for today. He's our technician. Other staff, Dr. Qasim sir, and Dr. Qasim sir's team, Dr. Karthik
Kranti.
Kranti, I am sorry. And this is the patient. Dr. Kranti, what did you do to this patient? Whether this patient is in general or local anesthesia? General anesthesia. What is the kind of surgery you have been planning?
Plus septoplasty.
Okay, like you are going to do endoscopic sinus surgery along with septoplasty, right? So, what is that you have connected here? This is the tube.
This is endotracheal tube.
Okay. And this is connected to
This
the
is the
ventilator.
ventilator,
Okay.
like anesthesia machine.
So I just see that this tube is again connected here through some tubes, and this tube comes to the what do you call this? Ventilator, right?
Yeah.
This is the ventilator. So
Anesthesia station.
while this patient is being operated, like this patient is unconscious, right?
Right.
Totally unconscious.
Totally unconscious.
Once the surgery is done,
Yeah.
then you bring that patient to conscious level.
Yeah.
And the patient will start breathing normally. So, thank you so much, Dr. Qasim, for spending your valuable time for viewers and talking to them about anesthesia. We'll join you soon again talking about different types of anesthesia in detail.
Thank you very much.
Thank you,
It's
Dr.
my
Qasim.
pleasure.
Thank you for watching us. Please watch, share, like, and subscribe to Mozoomin. Mozoomin. Thank you. Welcome to Med Talks with Dr. Moin.